And here we are with lecture 30, starting with 21.6, acid-base imbalances. Notice then we're jumping in by going to page 818 and figure 2113 down at the bottom right corner of the page. You should first of all know that in terms of the pH of arterial blood, the pH of blood in the arteries, the normal pH range, as you're seeing, is 7.35 to 7.45. You should also be familiar with the terms, and look up at the top of the figure now, acidosis and alkalosis. And notice then that if a person's blood pH, arterial blood pH, is below 7.35, if it's more acidic than 7.35, then we say that person is in a state of acidosis. And notice also, if a person's arterial blood pH is greater than 7.45, more basic, more alkaline than 7.45, then we say that person is in a state of alkalosis. So we're looking now at page 819, figure 2115, lower left-hand part of the page then. And notice now we're talking about conditions that can lead to respiratory acidosis. So blood being more acidic than normal as a result of something having to do with respiration, as a result of something having to do with breathing. And if we work our way up the figure from the bottom where it says respiratory acidosis, and think about it then, what can cause blood to become more acidic? And one answer then, if you go up above now, where it says respiratory acidosis, recall that the accumulation of carbon dioxide in the blood causes more acidity, causes now the term that we're using, acidosis. If you want to quickly review why this is, why an increase in carbon dioxide leads to an increase in blood acidity, if you quickly flip back to page 817 and figure 2110, and look at the top three boxes of that figure, and recall then, as we talked about last time, when cells are producing more carbon dioxide, this means that there's more CO2 to react with water in the plasma. This means we're producing more carbonic acid, H2CO3, and of course this means then that this increased amount of carbonic acid will release more hydrogen ions into the bloodstream. So again, I did that too quickly for you to jot these notes down again, but you'll recall if you go back to your last lecture again how that process works. And so now we're back to 2115 on page 819, again, lower left-hand corner. And the question now is, what kinds of things can cause an accumulation of carbon dioxide in the bloodstream? And several examples are provided up above. So if we decrease the rate and depth of our breathing, this means we're exhaling less carbon dioxide per unit time. So decreasing the rate and depth of breathing causes CO2 to build up in the blood. Middle upper part of the figure, if there's an obstruction of air passages, again, think about that one. So if our air passageways are obstructed for whatever reason, this also means that we're able to exhale less efficiently. We're able then to get rid of carbon dioxide, which of course we exhale, less efficiency. and we're accumulating carbon dioxide as a result. And finally, if we have decreased gas exchange going on, again, think back to ANP1 and the exchange of carbon dioxide and oxygen across the membranes of the alveoli. And so don't write that all down, but just recall what's happening here. So again, if we have decreased gas exchange, this means less carbon dioxide is diffusing out of the blood, less carbon dioxide is getting into the alveoli, therefore, less carbon dioxide is being exhaled. And as a result, again, CO2 is now accumulating in the bloodstream. Next, we'll consider acidosis again, but now instead of respiratory acidosis, we'll talk about metabolic acidosis. So metabolic, again, implying, and this doesn't have to go into your notes because I'm sure you know it by now, but think about it. So metabolic, again, implying metabolism, implying chemical reactions. And now we're going to be talking then about what kinds of things, other than respiratory chemical reactions, reactions involving CO2, what other kinds of things can lead to acidosis and can lead to so-called metabolic acidosis. And so we're on page 819 again, upper right-hand corner now to figure 2116. And notice now, factors leading to metabolic acidosis. Let's begin by looking right in the middle of the figure where it says metabolic acidosis. And let's work our way up from the middle towards the top. So what types of things can cause acidosis? And typically then, if it's metabolic acidosis, we're talking again about the accumulation of non-respiratory acids. We're talking about the accumulation of acids that don't involve breathing, that don't involve carbon dioxide. So again, metabolic acidosis may be caused by the accumulation of non-respiratory acids. And if we work our way on up, then what can cause this kind of accumulation? Either if the kidneys are failing to excrete acids, or if we're producing a lot of acidic ketones. Again, either of these can lead to metabolic acidosis. If we work our way down from where it says metabolic acidosis, another way for the blood to become more acidic, another way besides accumulating acids, is to lose bases. And so excessive loss of bases can result in acidosis. What kinds of things then would cause us to lose bases? And essentially now we're talking about, going down to the bottom of the figure, losing some alkaline, losing some basic secretions from the small intestine. So if we're losing alkaline, basic intestinal secretions, how might this happen? Either prolonged diarrhea or prolonged vomiting, basically losing these alkaline intestinal secretions out one end with diarrhea, or out the other end with really impressive vomiting that involves losing intestinal secretions, and not just vomiting that involves losing the contents of the stomach. And again, these intestinal secretions are basic, are alkaline. From here then, we're talking about alkalosis. And so on page 820, let's look at figure 2117, upper left-hand corner. So again, respiratory alkalosis, the blood becoming more basic, more alkaline due to breathing, due to respiration, due to something having to do with carbon dioxide. And again, let's work our way up from where it says respiratory alkalosis, caused by a decrease in concentration of hydrogen ions, just by definition. If it's alkalosis, then the blood is becoming more alkaline, more basic, less acidic. So again, there must be a decrease in hydrogen ion concentration in the blood. What can cause that? Well, if it involves breathing, if it involves respiration, we're talking about a decrease in concentration, next box up, of H2CO3, of carbonic acid. Why might we have less carbonic acid? Working our way up, because there's less CO2 to react with water and to produce the carbonic acid. Why might we have an excessive loss of carbon dioxide? If we're hyperventilating, if we're getting rid of CO2 more rapidly than normal. And what causes hyperventilation? Top row now, things like anxiety or fear or poisoning or high altitude. And finally, looking now at 2118, what can lead to metabolic alkalosis? Alkalosis involving something other than breathing. And so working our way up from where it says metabolic alkalosis, if we lose acids due to, going on up, gastric drainage or vomiting of gastric secretions or some diuretics, again, all of these kinds of things can cause us to lose lose non-respiratory acids, producing metabolic acidosis. And then finally, if we go from metabolic acidosis, that box now, and work our way down, remember alkalosis can result either from losing acids, that upper part of the figure that we just talked about, and alkalosis can also result from gaining of bases. So acids and bases are opposite in terms of what they do. Alkalosis and acidosis are opposites in what's going on here. So metabolic alkalosis may involve the gain of bases rather than the loss of acids. What can cause the gain of bases? Back down to the bottom part of figure 2118 now. And one thing that can cause this gain of bases is an excess ingestion of or an excess administration of antacids. Antacids, of course, just by their name, tell us that they reduce acidity. And again, reducing acidity means a gain of bases, meaning alkalosis as a result. And this concludes the last lecture. And congratulations to everyone for having hung in there all the way to here. And with that, I will wish you good luck on your 4th lecture exam.